Hello, my name is Ed Cutler. I'm the Director of Anesthesia here at St. Anthony. I want to thank you for considering St. Anthony for your total joint surgery. Today I'm going to talk to you a little bit about what your options are and what you can expect when you come to St. Anthony for your surgery. I know many of you have probably had surgery in the past, but I don't know if you've had joint surgery or not, so there's a little more detail we like to explain to you. So today I'm going to talk to you a little about what type of anesthesia is available. Secondly, what you can expect from us and the daily process. When you are scheduled for joint surgery, you will be contacted by our same-day surgery nurse or our outpatient surgeon, and they're going to go over your health history with you. They're going to find out about things like problems in the past with anesthesia, medications, an entire plethora of many things that we need to talk about. This is used as a screening tool. If everything is okay, you probably won't hear from us till the day of surgery. However, there may be times we need further testing or clarification. We will contact you. The day of surgery, you'll come to the same-day surgery unit. It's important to remember that this is where we are going to launch your surgery from. Again, you'll meet several people. They'll ask you a lot of questions. And finally, you'll get to meet anesthesia. Your provider will come in. He's going to ask you several questions. Many you might feel you've been asked before, like allergies and things like that. It's only to ensure your safety. Once we have a clear picture of your health, we want to talk to you about your personal experiences in surgery. That is vital. We want you to be comfortable. This is what we are going to talk to you about. We're going to give you some choices. The first choice we're going to talk to you about is called spinal anesthesia. Spinal anesthesia is the involvement of placing a needle in your back and dropping some medicine in there that will numb you from about your waist down. That you will not feel anything, you won't be able to move, but that all comes back after about 4 hours generally. It's a very safe procedure. It allows you to breathe on your own. We don't have to place a breathing tube, we don't have to do things like that. But it's also important to remember that you will be sedated while this happens. In other words, you probably won't remember much of this. The benefits of a spinal anesthetic is you get to continue breathing on your own. We just give you supplemental oxygen. We keep you sedated. It is a quicker way to get in and out of anesthesia. It's very, very safe. There are some chances that we could cause a headache. That's a pretty rare occurrence. There's a chance that it could last longer than we wanted. That's an extremely rare occurrence. Realistically, the nice benefit of that is that you get a longer pain control. Studies have shown how better patients do with pain after having a spinal anesthetic. However, you might not be comfortable with that. And if you have some hardware in your back that may preclude us from doing that, we need to talk to you about general anesthesia. General anesthesia is the type of anesthesia that where people go to sleep totally. You know that we would place a breathing tube in there, take over your breathing for you, introduce anesthetic gases. Very, very safe. There is nothing to say that this isn't a safe way of doing it. The drawback a little bit is that you tend to be more tired. There's a lot more incidents of nausea and vomiting, and a little bit of a higher bleeding rate when you have a general anesthetic. That is, again, not to say if you are not comfortable with the spinal anesthetic, we can put you to sleep. Again, there are some risks involved. Like I said, nausea and vomiting, small chance we could knock out a tooth because we are putting a breathing tube in. But that's a very rare occurrence. And again, some more, maybe a little harder to control your pain. That brings us to the final part. Joint surgery is, well, quite frankly, is painful. We have ways to abate that pain. And the way we do that here at St. Anthony is we use blocks. There'll be a block if you're having your hip done. We would do a block either in your hip or your groin, or if you're having your knee done, it'll be in your groin and down in behind your knee. This helps control pain after surgery for approximately 18 to 24 to 36 hours. Generally, most people, as this thing is wearing off, are able to control their pain with just pain pills. And we find that this works very well, very safe. We would do this in the pre-op area before we take you back to surgery. Keep in mind, you will be sedated. You probably won't remember much of it, but it is a very safe thing. The only danger we feel is sometimes it can last longer than we want them to, but that's extremely rare. To summarize, you'll have some choices when you come in. Spinal anesthetic, general anesthesia, remember, the one that we place in your back and numb from your legs down, or general anesthetic that puts you all the way to sleep. And remember, the block that we like to use to keep you comfortable post-operatively is another one of your choices. Again, you will have a chance to talk with your provider who will explain to you what we can do and what you're most comfortable with. Your comfort and your safety is our #1 concern. And if you have any questions, feel free to call the anesthesia department and we will be glad to talk to you and answer questions. Thanks so much for choosing St. Anthony.
Welcome. Thank you for choosing St. Anthony Regional Hospital for your total joint replacement. My name is Sandy. I'm one of the orthopedic nurses up at St. Anthony. In this video, we'll be showing you what you'll be doing on day 1, 2, and 3, what your dressings will look like, and how you'll be moving. We will show you how we take care of your pain, and we'll show you what we do on discharge so you'll have a good understanding when you leave here. Again, thanks for coming.
Hi, I'm Paige. I'll be your nurse today.
Hi, Paige.
You're Doug?
Yes, I am.
Okay. You had a left total knee done. Are your legs still numb?
I can't feel nothing.
Good. And that might not wear off for 24 to 48 hours. Your dressing here, the doctor will change that. If it becomes soiled, we're just going to put another one over the top of it.
Okay.
And that happens sometimes. We're going to take your vital signs for quite often in the beginning, about every 15 minutes.
Okay.
And then we'll have to wake you in the night to get them done, so you probably aren't going to sleep the best the first night.
Okay.
You will get IV antibiotics to prevent an infection. Your incentive spirometer, we're going to have you use that about 10 times an hour. And it'll raise here when you breathe in and breathe out of this mouthpiece. If you do it when you're watching a commercial, watching TV, when the commercials come on, you can do that. You're going to use this when you have to urinate. You're not going to get out of bed for the first day, not until physical therapy sees you. So the lid comes off here and you just put it in place, and then you can go and then take it back out and we will empty it for you.
All right.
This is your pain scale. The pain scale goes from 0 to 10. 0 is no pain. 10 is the worst pain imaginable.
Okay.
So we'll reference this a lot when you have pain. You'll let us know what number it's at
Okay.
so we can get you medication to get it under control.
All right. Okay.
And you're not going to have 0 as a pain
Oh, really?
number, usually not right after surgery. It will ache a little, but we don't want you up in here.
All right.
This is your call light. You'll use the big red button in the middle to call for assistance, whether you need help from a nurse or a CNA. These blue buttons are lights above your bed. You can turn them on and off yourself with this.
Okay.
And then your TV is actually powered through this as well. The power button's in the middle, and then the numbers are here if you know what channel you want. Otherwise, volume up and down, channel up and down is right there.
All right.
So this will stay with you in the chair and in the bed.
All right. Thank you.
Okay, Doug, we've got your board up here. You'll have quite a few different people working with you while you're here.
Okay.
So to help you know who's taking care of you on what day, we have it written up here. The nurses, and then the CNA that will be taking care of you. The doctor that did your surgery, along with the doctor that will be taking care of any medication changes you need. And then we have your physical therapist and your occupational therapist written up there, along with your social worker. And the social worker helps you with, if you need any equipment when you go home and things, that's who would help you.
Doug, first thing we're going to do, we're going to take your SCDs off. I'm going to lift your leg, and we're going to take this pillow off from underneath your leg. Okay. Now we're going to turn you around to sit on the side of the bed. We're going to take your leg. You're going to use this arm and grab this rail here. Are you ready?
Yeah, I'm ready.
All right.
Ready?
1, 2, 3. Now scoot up to the edge a little bit until your foot hits the floor. Okay. Now we're going to put the gait belt on. This is so that we can handle you when you walk without pulling up on your arms.
All right.
Now we're going to raise the bed up. We're going to have your hands back on the bed. There you go. That should do it. Bend this knee. You're going to put most of your weight on your knee and then on your arm. You're going to get to your foot. You're standing, and then you're going to put your hands on here. We're going to help you.
Okay.
1, 2, 3. There you go. Now move this leg back. There. Get your bearings.
Okay.
Okay, now listen, we're going to direct you.
All right.
Walker, left foot. Lock the knee back, weight on your arms, right foot. Walker, left foot, weight on your arms, right foot. Walker, left foot, lock your knee, weight on your arms, right foot. Okay, back up with your good foot, then your walker, sore foot. Okay, now you feel the chair hitting your legs. Kick your sore foot out about 4 inches. Reach back with this arm. Now the other arm. Sit down gently. Okay, now we'll get that leg up for you. Hope you enjoyed the video. Thank you for coming. I did want to remind you that when you have a total joint replacement, that you'll need to take antibiotics the morning of and the evening of a dental procedure. That means cleaning or any kind of dental repair or a bad infection. Thank you for coming, and I hope to see you soon.
Hi, my name is Sheila Dentlinger. I'm a physical therapist here at St. Anthony Regional Hospital. You will start your physical therapy the day after your surgery. We have 3 main goals we'd like to accomplish while you are here. The first one is to be able to get in and out of bed independently and walk with your walker independently and safely. The second is to practice steps and getting in and out of a car, and to be able to do that independently and safely. The last one is to learn your exercise program and to be able to do that independently when you get home. These exercises are also very important for you to start doing at least 4 weeks before your surgery, if possible. Okay, Mrs. Tegas, we're going to practice your exercises now. The first one is an exercise called a long arc quad. So basically all you're going to be doing is kicking your leg forward and then back down. Good. And go ahead and keep doing that. And up again. Good, and back down. Good, okay, so now let's have you lay down and we're going to do the rest of the exercises in bed. Okay, the next exercise is a pretty easy one. It's called a quad set. So basically all you're going to be doing is just pushing your knee down into the bed, okay? Tightening that quad muscle right there. Good, and push down again, and then relax. And push down again, and relax. Good job, and push down again, and relax. Good job, one more time, push down, and relax. Okay, and then the next exercise will be to do something just called a heel slide. Just gonna put this here. So you're just going to bend your knee up and slide your heel up in the bed. Good, and back down. Does that hurt at all?
Aches a little bit.
Yeah. Up and then back down. Good job. Up and back down. Good. Okay, the next exercise is called hip abduction. So all I want you to do is slide your whole leg out to the side and then back in. Good job. Out and then in. Out and in. Good. Out and in. Very good. The next one is called a short arc quad. So we'll take a pillow or a small towel roll, and we're going to put this under your knee. And I'm going to have you go ahead and kick that leg up. Keep the knee down, and then back. Good. Is this still feeling okay? Yeah. Let me know if you need a break. Very good. So the last exercise, and probably the hardest one, is called a straight leg raise. You're going to bend up your opposite knee. There you go. And then with this leg nice and straight, you're going to lift it up off of the bed. Okay? Can you do that? I'll help you a little bit. And then back down. Good job. Up again. And back down. Good. And up again. And down. One more. Very good. How you feeling?
Pretty good.
All right. Well, those are the exercises. We'll be working on those a lot while you're in the hospital. Okay, Mrs. Tegas, we're going to help you get out of bed right now. So let's go ahead and get your covers off. And I'll help you with that operated leg, and you go ahead and push around with your arms. There you go. Go slow and kind of scoot out to the edge. Good. Now just sit there for a little bit. I'm going to put a gait belt around your waist. Whenever you're up in the hospital, we'll be using one of these. So now when you go to stand up, you're going to mainly stand up on your good leg, and the operated leg will be sticking out in front, okay? And you're going to push up from the bed with your hands. Good, and you can put that leg down on the ground. Great, okay. So now we're going to walk with the walker. So the walker will go first, and then the sore leg. Step forward, and then the good leg. Good. Walker, sore leg, good leg. Feeling okay?
Yes.
All right, good. Okay, Mrs. Tegas, we're going to practice the steps now. So at home, you're going to need a railing on one side, and you can turn the walker sideways on the other side. And a good rule of thumb to remember is to go up with the good leg and down with the bad leg. And you will also have someone to help you the first few times at home with this. So we're going to go up with the good leg, your right leg, and then follow with your left leg. Good. And now we're going to move the walker. Good. And up with the good leg, the right leg. Good. Again. Good. And the walker. Good job. Up again. Great. One more. Up again. Okay. So now we're going to turn around and come back down. So just turn around on the step. That's the way. Good. And you're going to hang on to the walker. Good. So now let's go down with your bad leg. That's your left leg. Good job. Walker. Bad leg down. Good. And when we get to the bottom step, you can just go ahead and put that right in front of you. And hang on to that and step down with the left leg. Very good. All right. And you're going to turn all the way around with your walker before you sit down. So, yep, turn that way. Good. And back up to the seat. And reach back. That's right. And bend. Watch your head. Good. Okay. Now scoot all the way back in there. Let's help that one in. There you go. Good. And now that leg. And all the way around.
Hi, I'm Kelly Reese. I'm an occupational therapist here at St. Anthony Hospital. Today I'm going to show you some tools to use in order to get yourself dressed and a tool to get you in and out of bed. I'm also going to show you some equipment that you can use in the bathroom to get on and off the toilet easier and also in and out of the bathtub easier. We're going to do this work on a patient who had a hip surgery today, but it can also be used for knee surgery. Hello.
Hi, how are you?
Good. Tim?
Yes.
I'm Kelly. I'm with occupational therapy. How are you?
Good, Kelly. Thank you.
Good. Yeah, I see you've had a hip surgery done. How's it feeling?
No pain.
No pain? Good. I'm glad to hear that. Have you ever had occupational therapy before?
No.
No? Okay, so what we do is our job is getting you back to taking care of yourself. So those things like dressing, bathing, cooking, cleaning, all that good stuff. Do you know your hip precautions?
No.
Okay, so the first one is after you have a hip done, there's certain precautions so that you don't go too far out of place and you can dislocate that joint. So our first one is no bending past 90 degrees. That also means no bending your knee up to your chest too far. The second one, no crossing your legs at your knees or your ankles. And then the third one is no putting your foot inward too far. Okay?
Okay.
So since you have those precautions, one thing we teach you how to do is get dressed with some tools over there that I brought in earlier. And because of those hip precautions, you can't bend over. So I'll show you how to use those tools, okay? Should we go ahead and do that?
Yes.
All right, let's get on out of bed. The first one I'm going to show you is the reacher. This one can help you get your pants on, and it also helps you pick anything off the floor that you need to get off the floor. So what you do with that is you're going to hook it on right here, where the drawstring is. Yeah. And then you always want to dress your surgical leg first, meaning this left leg, on the floor. Yep. Thread it all the way through until you see those toes. Good. And then rehook it on the other side. Now this one you can bend, so you can lift that leg up if you need to. Good. All the way on. Great. And then you would just stand up and pull them up the rest of the way.
Okay.
Good. So same thing, to get them off, you can start pushing them a little bit. There you go. Good. All the way off, and then the same thing. Surgical leg second. Good work. So the second tool I'm going to show you is the sock aid. This one helps you get your socks on. So what you do is you put the sock over like this. This can also help you get those TED hose on that you're going to have to wear after surgery for a while. In the same fashion. You just slide it on there, grab the ropes, throw them to the ground, place your foot in, and pull.
Okay.
Can you give that a try for me?
Yeah.
All right. Got all the way to the end. Good. Grab those ropes, throw it to the ground, place your foot in, and pull. Go ahead and pull, pull, pull. Nice job. And since you still have a little crease, you can use that reacher to pull them up the rest of the way. Yep, right underneath. Nice work. The next thing I'm going to show you, I can take that for you, is the shoehorn. This has a longer handle, so you're not bending over as far. So what this helps with is to get your shoes on. You can use that reacher to set your shoe up where you need it to be. And place your toes in first. Have that heel lifted a little bit. Come in with the shoehorn behind there. And push. Nice work. And then one other thing we have here is we have shoelaces. They're elastic. So they can replace these regular laces in your shoe. What that'll do is it'll make your tie shoes a slip-on shoe.
Okay.
So we can put those in there later, okay?
Okay.
All right. To get those off, our last tool. This is a dressing stick. This will push your shoes and your socks off. So go ahead and put it to the back here. Yep, and push. Oh, you're getting a 2-for-1. Good job. Yep, and then that will go right to the top and push. Good work. Think you can handle those?
I think we're gonna make it.
Alrighty, good job. Tim's gonna show us some equipment here that you can use in the home. This piece of equipment is a toilet seat riser. It elevates your toilet so you're not sitting down too low after a total hip surgery. It can also help you get back up due to some pain after a total knee surgery. This one has rails, so as you saw, Tim just pushed right up and he could walk right off the toilet. This next piece of equipment is a tub transfer bench. Tim's gonna go ahead and have a seat. You can go ahead and swing one leg over. Yep, make sure you bend backwards so you're not breaking those hip precautions. And then the other foot goes in. Nice work. The reason we use this tub transfer bench is for people who are having difficulty stepping over that ledge safely and effectively. So same thing for the way out. Swing one leg over. And then the other. Some additional helpful hints upon returning home after a total knee or total hip surgery are to first make sure your walkways and doorways are wide enough to fit a walker down. Second, make sure you remove all clutter from hallways and open areas. The clutter could be a potential tripping hazard, and also remove all those throw rugs because those can be a tripping hazard also. Another helpful hint is to make sure that your recliners and chairs that you're going to be sitting on aren't too low to the ground. If they are, you might need to put a block underneath them, or also think about getting a lift chair. Thanks for listening.
Hello, my name is Melissa Schultes. I'm one of the social workers here at St. Anthony Regional Hospital. I work with Chris Valentine, and we are the Discharge Planners and are available to help you with your discharge needs after your surgery. We will help arrange for any medical equipment or home health nursing, lifeline, Meals on Wheels, anything that you might need to be able to be successful in your recovery after your surgery. Hi, Don. My name is Melissa. I'm going to be your social worker while you're here at the hospital following your surgery. I do work with Chris Valentine, so between the two of us, we are available to help with any discharge needs that you have. So what I'd like to do is help arrange for any medical equipment, if you might need a walker, cane, shower chair, toilet seat riser, any of those types of things. We do have a loan closet, and you can borrow those items while you're recovering from your surgery. We've also got home health available. Might you need that? There's lifeline services, Meals on Wheels. There's a number of different things. Now, since you are a Medicare patient, you may have been contacted by DMOS.
Yes.
Okay. They do have a care improvement initiative. They try to contact the Medicare patients to discuss with you any of your discharge needs. We are available to help with your discharge needs, and between Chris and I, we are here Monday through Friday. Our name and number will be on your communication board in your room, so if you need to call us, please do that, and we'll be available to help, and I wish you the best with your recovery.
Morning, Doug. My name's Sandy. I'm going to be your nurse today.
Hi, Sandy. How are you?
I'm good. I see the doctor has taken off your ACE wrap and you have an island dressing. We put your other TED sock on. That's to prevent blood clots. You'll be wearing those at home for a while. You'll be wearing them at least until you see doctor in the office. And he's written your discharge instructions.
Okay.
And I'd like to go over those with you and your wife when she comes in, if you want to.
Okay.
I do have a prescription that you'll have to have filled when you leave. There are no refills on that, so you'll have to keep track of how many of them you have left before the weekend.
Okay.
And if it's a holiday on Monday, they're closed on Monday, so you'll have to get a hold of the doctor's office so they can get that filled ahead of time.
Oh, okay.
Now, you know, with those pain pills, you're not allowed to do any driving
Right.
because it's the same as a drunk driving ticket. If you, okay, you're not supposed to make any decisions either, like sign your house away when you're taking those, okay? Okay, I want to go over a few more things here. You know, you had your knee done,
Right.
okay, so you have to be careful not to get an infection in there. So you can take a shower, but you cannot get in a pool.
Okay.
You can't get in a lake or a hot tub. I know you think a hot tub would feel good, but it can get an infection in there, okay? And that's for about 6 weeks. You can shower, but you can't get in the pool. Your diet is the same as you were before. Are you a diabetic?
No, I'm not.
Okay, so you can just eat a regular diet, just eat healthy.
Okay.
The big thing here is those pain pills that you take are extremely constipating.
Okay.
So you have to take those stool softeners like the doctor gave you here at the hospital.
All right.
They're over the counter. You take one in the morning and one in the afternoon.
Okay.
And if that doesn't work every third day, you need to take a little milk of magnesia.
All right.
Okay. Now you really don't have any limits other than you can't drive until he says so. We want you to not put a pillow, see how your pillow is right here? But you cannot put that pillow up under your knee where it's most comfortable, because that shortens that muscle back here. So we like to keep it right down here, okay? Alrighty. Also, you can't take Tylenol with these drugs you're taking. These pills that you have also have Tylenol in them. So if you took it besides, it would be too much Tylenol. Okay. You'll also be on this blood thinner. Each patient has their own blood thinner that doctor feels is specific for you. If you were on Coumadin before the hospital, you'll go home on Coumadin. Sometimes if you're a fracture, he puts you on an injection. But if you don't have any other reasons, he will probably put you on aspirin. And that's 325 milligrams. So if you were taking an 81 milligram before the surgery, you'll just be taking a 325. When you go home, I can send you home with a few of those dressings if it's draining a little bit, okay? If you need a refill, call the doctor. Oh, since it's Sunday, you're going home today, I can't make your appointment. So on Monday, you need to call the doctor and set up your appointment for 7 days, next Monday, okay? So I want you to report any shortness of breath, fever, excessive drainage, or if you suddenly get a lot more swelling in here, lay down, put your foot up, put a little ice on it. If it starts to get worse, the doctor is going to want to know about it. The other thing is you can always call here and ask us questions. We're always there for you. Alrighty? Now when you leave, we're going to pack up your whole room. Don't forget your phone charger. Everybody forgets their phone chargers. And we will put you in a wheelchair. We'll take you to your car and help you get in the car.
Okay.
Do you have any questions for me?
No, I don't believe so, right.
All right. It's been a pleasure taking care of you.
Thank you, Sandy.
Thank you for coming to
Appreciate
St.
it. Thank you.
Anthony's.